This is Dr. Shin of Seoul National University Children's Hospital, and I'm speaking to you about our JBS article, Incidence and Clinical Characteristics of Stripped Capital Femoral Epiphyses in Patients with Endocrinopathy, a population-based cohort study. Patients referred from the endocrinology department are often concerned about their hip or knee pain being related to stripped capital femoral epiphyses or SCFE. They sometimes ask me how likely it is that they will have SCFE. While we know the incidence of endocrinopathy in patients with SCFE, we do not know the incidence of SCFE in patients with endocrinopathy. To address this knowledge gap, we conducted research.
As SCFE is a relatively uncommon disease, we attempted to analyze big data. However, we face challenges in identifying patients with specific endocrinopathy, such as growth hormone deficiency or sex hormone deficiency, due to the lack of information in traditional data sets. To overcome this, we integrated their diagnostic codes and prescription records. We are surprised by the dramatic increase in the incidence of SCFE as the number of deficient hormones increased. Besides, it was intriguing to find that over 25% of endocrinopathy-associated SCFE developed more than 5 years after endocrinopathy diagnosis.
Pediatric endocrine disorders often necessitate long-term hormone replacement therapy. Thus, it's important to be aware of the potential SCFE risk during hormone replacement and prioritize appropriate hormone supplementation. In cases where SCFE risk is heightened due to multiple hormone deficiencies, collaboration between pediatric endocrinologists and pediatric orthopedic surgeons for ongoing monitoring is essential. Our findings indicate that children with endocrinopathies need long-term monitoring for SCFE.
Although our research focused on patients below 19 years old, we noticed that SCFE occurs in some older patients with endocrinopathy. Therefore, it's necessary to conduct future research to gather long-term cumulative data on older age groups. Additionally, it's crucial to investigate the pros and cons of prophylactic contralateral surgery in patients at a high risk of developing SCFE due to multiple hormone deficiencies. Thank you.